Your next visit will be at the 28-week mark. At 28 weeks, then we do offer screening for gestational diabetes. Gestational diabetes is a term that is used to define an abnormal blood glucose tolerance during pregnancy. It occurs in 2 to 5% of pregnancies, but that risk and that occurrence raises depending on certain risk factors. Some of those risk factors are your age, the ethnical group that you belong to. So if you are Hispanic, African American, or Native American, then you may have an increased risk. Others are if you have a family history of diabetes in your family, whether that be with your mother, your father, your siblings, or your grandparents. If any of them have diabetes, then you are at an increased risk for getting gestational diabetes. Other things that are risk factors are polycystic ovarian syndrome, hypertension, and if you have a history of giving birth to a previous baby that was 9 pounds or larger, if you had an unexplained stillbirth, or if you had gestational diabetes in a previous pregnancy. So those are some of the risk factors that are associated with the occurrence of gestational diabetes. Now, we do have a few ways that we offer to screen for gestational diabetes. The first one is considered the most accurate, and it is having you drink a drink called glucola. And with that, then you would fast for a certain amount of time, and we would have you come in for a fasting blood glucose test, give you the drink, and then 1 hour later we would test that again. If you are showing signs that you may have gestational diabetes, then we would offer a more extensive test where we have you come in, get the fasting fasting glucose level, have you drink the drink, then we would draw your blood at 1, 2, and 3 hours, and then see what that says. If you don't want to do that option, then there are other ones. One of them that we offer is a candy method where you can have a certain amount of jelly beans or Twizzlers, and we would do the same thing as that first test where we screen you for 1 hour and see if you may have markers for having gestational diabetes. Another one is a breakfast challenge where there's a certain breakfast that I can offer, that I can tell you to eat, and then you would again come in for a 1 hour draw. And the same with the smoothie. Those later ones, the candy, the breakfast, and the smoothie, they are not as accurate, and so we may miss gestational diabetes if you do have it. You could also choose to not get screened. That does come with its own risks, which I had said before, with developing hypertension, preeclampsia, and a small for dates baby, which again comes with the complications that I said earlier. You may be a safe candidate for this if you are low risk, meaning that you are younger than 25 years of age. You don't have any of those other risk factors that I listed above. Do you have any other questions?